Seeing that positive pregnancy test, wow, what a moment. But, you know, after that first wave of excitement, it's totally normal for a million questions to start rushing in. And that's exactly where the viability scan comes into play. Think of it as the first and, honestly, the most important checkpoint of your entire pregnancy. It's all about giving you real, solid answers right from the very beginning. So, you've seen it, that second line, and your world just changed. It's this wild mix of pure, over-the-moon joy and, let's be real, a little bit of, oh my gosh, what now, anxiety. Your mind is probably racing. Is everything okay in there? Is it, in the right spot? Well, take a breath. Answering those exact questions is the entire point of this first scan. Before we even dream of seeing the baby's first picture, the number one top priority of this scan is actually you. Yep, this is the most critical checkpoint to make sure that this pregnancy is starting off safely for you, the mother. Your safety comes first.
Okay, so this scan, it represents a really fundamental shift in how you experience your early pregnancy. It's the exact moment we go from just hoping and wondering based on a test to getting clear visual proof of what's actually happening inside.
See, up until this point, your pregnancy has been what we call a chemical reality. It's confirmed by hormones that show up in your blood or urine. But this scan, it transforms everything into a clinical reality. Something we can actually see, measure, and confirm is developing right where it should be. It's the moment it all starts to feel incredibly real.
To really get why this scan is so vital, like truly non-negotiable, I want you to think about it with a really simple but powerful analogy. It all comes down to a seed and its soil.
Here's how it works. Your uterus? That's the rich, safe soil. It's the only place the seed, the pregnancy, can properly implant and grow. But sometimes, on its journey to the soil, the seed can get stuck in the pipeline, which is the fallopian tube. And if it starts to grow there, well, that's not just a problem, it's a real danger.
And that right there brings us to the single most important goal of this scan, to confirm the pregnancy is intrauterine, safely in the uterus, and to rule out an ectopic pregnancy. A pregnancy in the tube is a serious medical emergency. And this is so important, if we catch it super early on this scan, it can often be managed with simple medication, no major surgery needed. It's all about early detection. So, to break it down, this scan has three main jobs. First, location, location, location. Make sure it's in that safe spot inside the uterus. Second, confirm viability, and that means seeing that tiny flickering heartbeat. It's an amazing moment. And third, we set your gold standard due date. We do this by measuring the Crown-Rump Length, basically from the top of the baby's head to its little bottom. In these early weeks, every embryo grows at the exact same rate, so this measurement is incredibly accurate. So now we know why the scan is so critical. Let's switch gears and talk about the how. Think of this next part as your game plan, your clear, actionable guide to make sure you get the best, clearest results possible at your appointment. Timing, let me tell you, is everything. The sweet spot is between 6 and 9 weeks, but if you can, aim for 7 weeks. That's the ideal target. Why? Because if you go too early, like at 5 weeks, we often can't see the embryo or a heartbeat yet. And this can lead to a really scary-sounding diagnosis of pregnancy of unknown viability, which just means a week of totally unnecessary panic for you. On the flip side, if you wait too long, the dating just isn't quite as precise. Now let's talk tech. Think of the standard abdominal scan, the one they do on top of your belly, like watching an old TV from the 90s. Sure, you can see the picture, but it's kind of greeny. The Trans-Vaginal Scan, or a TVS, though, that's like upgrading to a brand new 4K Ultra HD screen. The picture is just crystal clear. And because the probe is so much closer, it can actually pick up a heartbeat a whole 5 to 7 days earlier. It's a game changer. And here's the wild part. The prep for these two scans is the complete opposite. It's so important to know which one you're having. For the abdominal scan, you need a full bladder. Think of it like a window that pushes your uterus up and gives us a better view. But for the TVS, you need to do the exact opposite. Empty your bladder completely right before the scan. A full bladder actually gets in the way of that amazing high-def picture. All right, let's clear the air. There are so many myths and fears that float around about this first scan, and it's time to bust them. We're going to separate the worried whispers from the actual medical truth. Let's tackle these head-on. First,
The idea that a TVS is somehow harmful, that is absolutely 100% false. The probe stays in the vagina. It never ever enters the uterus or touches the baby. It is the global standard for safety and accuracy. Second, that old wives' tale that the heartbeat speed can predict the gender? Nope, zero scientific evidence. The heart rate just changes as the baby grows. It's a sign of health, not gender. And finally, this is a big one. If there's no heartbeat at 6 weeks, please don't assume the worst. Late ovulation is super common. The standard normal procedure is to just come back for another scan in about 7 to 10 days to see how things have progressed.
Okay, I need to shift gears for a second and talk about some really critical safety information. Look, most of the time everything is fine, but there are a few symptoms you can't afford to ignore. If you experience any of these, you need to seek medical care right away.
These are the absolute red flags. We're talking about heavy, bright red bleeding, not just a little bit of brown spotting. Sharp, one-sided pain deep in your lower abdomen. That's a classic sign of a possible ectopic pregnancy. And this last one is very specific. A sharp pain right at the tip of your shoulder, especially when you lie down. That can be a sign of internal bleeding. If you have any of these, do not wait for your appointment. Go straight to the ER.
Okay, after covering those really serious warnings, let's bring it back to the incredible positive power of this scan. Because when all is said and done, this whole process is about one thing: replacing that early anxiety with cold, hard, data-driven reassurance. I just love this quote from Dr. Prashanth because it really nails the feeling. This scan is the moment your pregnancy becomes real for many parents. It is normal to feel anxious. It's just a perfect reminder that this is a huge deal, and whatever you're feeling is completely valid.
Now just look at this number. Less than 5%. Let that sink in for a second.
That's what that number means. For women under 35, once you see a strong, healthy heartbeat at your 8-week scan, the risk of miscarriage plummets to less than 5%. This scan isn't just a picture, it's not just a milestone, it is a massive, statistical sigh of relief that tells you your pregnancy is on a strong, healthy path.
So there you have it. This scan is your first major safety checkpoint. It's the confirmation that the seed is in the right soil and it's growing strong. You've passed it. Now you can take that deep breath you've been holding, let go of some of that early worry, and get ready for the amazing journey that's waiting for you.